LASIK is a surgical procedure intended to reduce a person's dependency on glasses or contact lenses. The term LASIK stands for laser-assisted in situ keratomileusis and is a procedure that permanently changes the shape of the cornea, which is the clear covering over the front of the eye. LASIK is an outpatient surgical procedure that usually requires about 15 minutes per eye. Before the procedure, you will be asked to lie on your back and remain still. Topical eye drops will be used to numb your eye, and the area around the eye will be washed and cleansed. You may also be given a sedative to help you relax. Your doctor will use an instrument called a lid speculum to hold your eyelid open and then place a ring on your eye that creates suction on the cornea. You may feel pressure and experience dimming of your vision at this point in the surgery. Once the ring is firmly in place, your doctor will attach a special device called a microkeratome to the suction ring. Using the blade on the microkeratome, your doctor will create a corneal flap by cutting approximately the outermost 20% of your cornea and lifting it carefully to one side. After removing the suction ring and microkeratome, your doctor will use pulses from a computer-controlled excimer laser to reshape your cornea by vaporizing tiny portions of its interior. This part of the procedure usually takes less than 60 seconds. Your doctor will then replace the corneal flap into its original position and observe the eye for several minutes to ensure bonding. Because the cornea bonds so quickly, healing is rapid and the eye does not require stitches. After the procedure, your doctor will administer antibiotic drops and place a shield over your eye to prevent you from rubbing it or from putting pressure on it while you sleep. Since you will not be able to drive immediately following the procedure, you will need to make arrangements for a ride home.
PRK, or photorefractive keratectomy, was the first type of laser eye surgery for vision correction and is the predecessor to the popular LASIK procedure. In PRK, no flap is created. Rather, the epithelial cells on the eye surface are simply removed. An excimer laser is then used to reshape the cornea just like it does in LASIK. The vision correction outcomes of PRK surgery are comparable to those of LASIK, but the recovery period is longer. This is because the epithelium is completely removed in PRK, and it takes a few days to regenerate. PRK patients also have more discomfort and haziness of vision in the first few days after the surgery. Improved vision also takes longer to achieve. PRK does, however, offer certain advantages. Because PRK does not involve creation of a flap, which contains both epithelial and deeper stromal tissue, the entire thickness of the stroma is available for treatment. The treatment range is therefore higher. This is particularly useful for patients with high levels of myopia or for those whose cornea is too thin for LASIK. PRK is also free of flap-related complication risks.
The Vision ICL lens is folded and placed into the eye through a tiny opening. Once inside the eye, the lens slowly unfolds, and the soft edges of the lens are then gently tucked behind the iris. The entire procedure usually takes less than 15 minutes, with complete recovery in 1 to 2 days, usually much sooner than alternative vision correction procedures.
The Blind Boy by Collie Sibber. Oh, say, what is that thing called light? which I must ne'er enjoy. What are the blessings of the sight? Oh, tell your poor blind boy. You talk of wondrous things you see. You say the sun shines bright. I feel him warm, but how can he or make it day or night? My day or night myself I make, whene'er I sleep or play. And could I ever keep awake, with me 'twere always day. With heavy sighs I often hear you mourn my hapless woe, but sure with patience I can bear a loss I ne'er can know. Then let not what I cannot have my cheer of mind destroy. Whilst thus I sing, I am a king, although a poor blind boy.